LE-style multiple-choice questions, 5 choices each, based on Cytomegalovirus CMV HHV5, including clinical presentation, pathophysiology, and treatment. Question 1. Immunocompetent patient. A 22-year-old man presents with low-grade fever, fatigue, and mild sore throat. He is sexually active with multiple partners. Physical exam shows no tonsillar exudates, but mild posterior cervical lymphadenopathy. A monospot test is negative. Peripheral smear shows atypical lymphocytes. Which of the following is the most likely cause of his symptoms? A. Epstein-Barr virus, B. Cytomegalovirus, C. Streptococcus pyogenes, HIV-E adenovirus. Explanation: CMV can cause a mononucleosis-like illness in immunocompetent patients. Monospot negative distinguishes it from EBV. May see atypical lymphocytes, reactive CD8 plus T cells. Transmitted by saliva, sex, transfusion, urine, and organ transplant. Why not the others? A. EBV causes monospot positive mono. C. S. pyogenes usually causes acute tonsillitis with purulent exudate. D. Acute HIV may mimic mono but has other systemic symptoms, rash, ulcers. E. Adenovirus may cause pharyngitis but less commonly mono-like illness. Question 2. Congenital CMV. A 28-year-old pregnant woman is exposed to a toddler in daycare. Her fetus is later diagnosed with intrauterine growth restriction, paraventricular calcifications, and sensorineural hearing loss on prenatal ultrasound. Which of the following pathogens is the most likely cause? A. Toxoplasma gondii, B. Cytomegalovirus, C. Herpes simplex virus, D. Rubella virus, E. Parvovirus B19. Correct answer B. Cytomegalovirus. Explanation: CMV is the most common congenital viral infection. Causes sensorineural hearing loss, paraventricular calcifications, microcephaly, petechiae, blueberry muffin rash. Transmission often via urine saliva from young children. Why not the others? A. Toxoplasma causes intracranial diffuse calcifications. C. HSV causes skin, eye, brain temporal involvement, not paraventricular. D. Rubella causes PDA, cataracts, deafness. E. Parvovirus causes hydrocephalus. Question 3. Treatment in immunocompromised patient. A 46-year-old renal transplant recipient presents with fever and worsening shortness of breath. Chest X-ray reveals bilateral interstitial infiltrates. PCR confirms cytomegalovirus pneumonia. Which of the following is the most appropriate treatment? A. Acyclovir, B. Ganciclovir, C. Valacyclovir, D. Foscarnet, first line, E. Oseltamivir. Correct answer B. Ganciclovir. Explanation: Ganciclovir is the first-line treatment for CMV infections, especially in immunocompromised patients. Can also be used prophylactically in transplant patients. Why not the others? A. Acyclovir is less effective against CMV. C. Valacyclovir is better for HSV-VZV. D. Foscarnet is used for Ganciclovir-resistant CMV. E. Oseltamivir is for influenza AB. Let me know